Well guys, it is a new year and I'm here at the drugstore to share with you guys some skincare gems. One thing about Listerine is that it might actually be helpful for toenail fungus because it has similar compounds in it to Vicks Vapo Rub, the thymol. And that is, Vicks Vapo Rub at least has been shown to be, oddly enough, helpful for cutting down on toenail fungus. And it's thought that maybe it's the thymol or the eucalyptol, but you also have that in Listerine. This is a nice little set from Avent. You get the tolerance control cream, this thermal spring water spray, and then you get their extremely gentle cleanser. Really like the moisturizer and the cleanser, and the thermal spring water spray may be beneficial in reducing like irritation. In theory, compounds in thermal spring water are anti-inflammatory as they come from certain thermophilic bacteria. This is a great little set though if you're looking to do a skincare reset. Something I recommend doing if you are in the middle of a skin problem, you don't know exactly what's going on. It's a way to just pare down your skincare routine to the bare essentials: a really mild cleanser, a moisturizer, and a sunscreen. So they have a mineral sunscreen that is a nice option. They have one that's tinted and one that is not. The Solar UV SPF 50. This is a nice lightweight fluid mineral sunscreen, but it does leave a white cast. The tinted one, the tint's not too orangey. The nice thing about the tinted mineral sunscreens is the tint may offer some additional protection against visible light, which contributes to hyperpigmentation. Now, this product is quite underrated, although here at Walgreens it's super expensive, but it's a really good product, this SPF compact. It really gives very good coverage. This was actually what was used in one study showing the benefit of tinted sunscreens in helping to clear and prevent hyperpigmentation because of the iron oxides. So this is a great option, and it's really nice for reapplying sunscreen on the go, although it's not going to be like a full layer like if you were rubbing in a cream, but it's actually pretty good. Now this is new from them. This is an SPF 50 mineral sunscreen for face and body. $50? Yikes, that's expensive for a zinc oxide face and body sunscreen, but I'm sure it's very good for sensitive skin. This is new from them, Hyaluron Active B3. What is this? A niacinamide serum? Yep, with hyaluronic acid. So niacinamide's good for dry skin. It's anti-inflammatory. It may be helpful in defending against oxidative stress. Sodium hyaluronate helps improve moisture content in skin's outermost layer. Adenosine is anti-inflammatory. Glycerin is also hydrating. But $40 for this? Like, that's pretty steep because niacinamide serums are pretty popular. This kind of reminds me of the La Roche-Posay Effaclar Duo with the benzoyl peroxide 5.5%. $32. Now benzoyl peroxide is good for acne breakouts. Can be drying though. What in the a Brighten and Firm Chest Body Sheet Mask with panthenol and niacinamide. So niacinamide, it can help improve the signs of skin aging in theory. It's good for dark spots. It's also good for the moisture barrier and is anti-inflammatory. This actually looks pretty good. Acetyl hexapeptide 8, copper tripeptide 1. Those may help improve collagen production, but probably just help with moisture retention. Centella extracts are anti-inflammatory. Gold can be irritating, but it may potentially be anti-inflammatory. I personally would rather have those ingredients in a moisturizer to apply than a mask like this, because what about all this territory outside? Like, we're just gonna have a little heart shape of more radiant skin. So we were just over there by Avent, and they have that new mineral face and body sunscreen. This one from La Roche-Posay is really good. It has zinc and titanium dioxide. I think the cast is not too bad. It's a little on the shiny side, but this is a really good option. $22 here. Like, honestly, you could come over here and get the Banana Boat sensitive mineral faces, and I don't know, in my experience, it's not like too wildly different as far as the cast and the appearance on the skin, and it's significantly less. This is pretty bizarre to me. Okay, so tea tree oil has been shown to be actually promising for a couple of skin conditions: seborrheic dermatitis, acne, psoriasis, and potentially toenail fungus as well. But you can really develop a pretty rip-roaring contact dermatitis from applying it directly to the skin, especially if it gets exposed to light. The compounds in it can degrade and become super irritating. So if you're going to use it, it's recommended to dilute it in like a carrier oil. I don't recommend using it regardless. I mean, there's skincare products that utilize tea tree oil extracts that I think are a better option, less risky for irritation. This particular product, which is over here in the wound care section, it's telling you to put 2 drops on a moist cotton pad and apply it directly to the skin. Oh, for sensitive areas, dilute with a carrier oil. I would dilute with a carrier oil anywhere you're gonna use it. All that to say, I don't recommend putting tea tree oil on the skin. Neosporin is not going anywhere. These are so bad. Don't even get me started. Problem is, A, the antimicrobials are not very good. B, your cuts, your scrapes will heal just as well, if not better, just washing them out with a little dilute soapy water and putting plain petroleum jelly, because all this is petroleum jelly plus these crummy antibiotics. There's a higher risk of contact dermatitis using these, and they also contribute to the emergence of resistant microorganisms, which is not good. So yeah, all of these are just not good. Even this one that it says it's antibiotic free, it has benzalkonium chloride, which is what's in a lot of alcohol-free hand sanitizers. And benzalkonium chloride, you definitely can contribute to resistant microorganisms, so I wouldn't recommend that either. Likewise, it's what's in this first aid antiseptic spray. Recently I came across a TikTok of this guy rubbing a chili pepper on his head for hair loss, and you know, I reacted to it. I don't recommend rubbing chili peppers on your head or your skin. You can easily develop a burn. Capsacin, which is what is in chili peppers, it has actually been shown to be helpful for androgenetic alopecia in a small study. Now, I'm not recommending that you apply chili peppers to your skin, but you know, one thing potentially I do wonder, would rubbing capsaicin cream on your scalp be beneficial? You know, more research is needed, but this is definitely a safer option, although expect it to burn. That's kind of how it works a bit for pain relief, as it kind of depletes the nerves of their little neurotransmitters temporarily. It also can help improve blood flow, but yeah, it definitely does burn quite a bit. Wash your hands after you apply this, because the last thing you want to do is put it on and then touch your eye. The other thing this is really good for, though, is if you have an itchy back. A lot of people get an itchy back and they rub it and the skin becomes hyper itchy because the nerves there get trapped easily, the way the muscles are, and you know, the way the nerves exit into the skin, they kind of are at an angle, so they get pinched easily and become sort of agitated and make you itch. Then people rub the skin and the skin thickens. All that to say, capsaicin can actually be helpful for calming that down. So this is a pretty versatile product here, $14.99. Menthol is another one that can help with itch as well, such as what is in this cold therapy pain relief. Now, it is a fragrance compound, so if you're allergic to fragrance, be aware. Plus this has like lemon balm in it as well, and camphor. But if you have like a really stubborn patch of itch, sometimes these things can be helpful to silence that. Alternatively, you can use a cool compress. Sometimes these are a lot more effective, just the way they work in terms of getting those little nerves to release. This one's got a lavender aroma to it. You can even get these patches that you put on. This is good for itch in the upper back area. It's meant for pain, but don't be surprised if it helps alleviate the itch. This Zeazorb AF powder is really good if you have very sweaty feet. People who have really sweaty feet, or they wear shoes that don't breathe so well, like certain occupations you have to stand a lot, creates a favorable environment for itch, first of all, flares of what's called dyshydrosis. I often talk about that on the hands, but it can happen on the feet. So it triggers, the sweat will trigger that, but then the sweat also causes maceration and allows for entry of foot fungus. So the Zeazorb AF powder is actually really good if you have sweaty feet, or you've got to wear closed-toed shoes for a prolonged period of time. It helps absorb the excess sweat, cutting down on flares of dyshydrosis, foot itch. Also helps cut down on foot odor, but then it likewise can help prevent foot fungus. For those of you who get itchy, red, inflamed rashes in the skin folds, oftentimes that's related to Candida yeast. It's called an intertrigo. Clotrimazole cream says here athlete's foot. This isn't actually that great for athlete's foot, but it can really be helpful for those yeast rashes that happen in the skin folds. This is actually a better option for foot fungus, the terbinafine cream. The fungus that often is on the foot, the dermatophytes, they're often resistant to clotrimazole, but terbinafine is more likely to be effective. Can be really hard though if you already have it in the nail to clear it up in the nail with just the cream alone. Oftentimes requires an oral medication. This is really good though if you do have a fungal nail infection, not so much for like getting rid of the fungus, but it helps to cut down, it's got urea and lactic acid. It helps to cut down on all the flaky buildup around the nail that the fungus kind of feeds off of. And then it also allows for better penetration of the antifungal medication in and around the nail. When you use a foot fungus cream, you want to make sure you put it to all surfaces of your feet, not just where you see the rash. You want to put it also underneath your toenails and around your nails to help prevent the fungus from getting in there. Y'all be careful with eye drops. There have been a lot of eye drops that have, the preservative-free ones that have become contaminated with bacteria. People have had issues. Unfortunately, the preservatives in eye drops, they can be disruptive to the tear film. So if you're going to use eye drops, they do make preservative-free ones that are in those single-use vials. I think those are a better option. A lot of people with rosacea have involvement of their rosacea with their eyes. They get red eyes, dry eyes, feeling like something's stuck. So lid hygiene is actually really helpful because a lot of what is related to rosacea has to do with those little Demodex mites. They seem to be way too comfortable in the skin of people who have rosacea, including around the eyes. So lid hygiene is really important. You can just use a mild facial cleanser around the eyes. Like, I don't know, these lid scrubs you don't necessarily need. Just make sure it's a fragrance-free, bland facial cleanser, and just gently massage the eyelids by the lash line to help exfoliate flaky skin and cut down on lid irritation. But you also have to be careful because some ingredients in eye drops you can become allergic to, and they cause red, irritated eyes. And it's one of those things, kind of like I've talked about with lip balms, where like you put the drops in and they feel soothing, they give you some relief, but then it takes a moment for your immune system to show that it doesn't like the ingredient because you're allergic to it. So then the dry, itchy, red eyes flare up again, and you actually reach for more eye drop because it is soothing, but it's actually the problem. Friendly reminder, don't store your razor in the shower. If you watch my video on skincare habits for the new year, one of the tips I give in that video is to stop storing your razor in the shower because the blades dull a lot faster in there. They may rust, and that puts you at greater risk for shave irritation, shave nicks, ingrown hairs, and it shortens the life of your razor quite a bit. So just take them out of the shower and lay them on a clean, dry washcloth to dry fully. Run the fan in the bathroom to cut down on humidity after a shower. That too is a good habit to get into. Oh my gosh, check it out, you guys. Neutrogena has Adapalene now. Same as Differengel, just in their acne treatment line. Glad to see that. Adapalene, check out my video on top 5 benefits of Adapalene or Differengel besides acne, but it's also great for fading dark spots, fading and preventing dark spots. It's anti-inflammatory and it can help with lightening age spots. It's also good for rough and bumpy skin texture because it may help normalize skin cell turnover that leads to the buildup of dry, rough bumps in the first place in keratosis pilaris. Using retinoid is also a good idea if you have warts. Speaking of storing your razor outside of the shower, you know, a dull razor can put you at risk for spreading little flat warts around, well, any razor, but you know, if it's dull, it creates more nicks and trauma to introduce the little wart virus. You can get an eruption of flat warts either on the face or the legs, wherever you're shaving, and it takes a while to clear those up. There are prescription treatments and in-office interventions that can help get them to go away faster, but a retinoid can also help. Melatonin gummies, they are a menace because, first of all, melatonin, you gotta be careful with it. It's great in, you know, situations where you have disruption in circadian rhythm as it relates to swing shift. There are other conditions and scenarios where it can be beneficial, but you have to be careful because, you know, it is a dietary supplement. They're not regulated like drugs are, so there's a lot of heterogeneity out there in terms of melatonin supplements, especially the gummies, because with the gummies in this bottle, like it says, per 2 gummies, you're getting 10 milligrams of melatonin. But in reality, there's a lot of heterogeneity in terms of the gummies. Like some of the gummies may have a lot, whereas others may have less. So that's something that's been shown. Like the gummies, I think, are really hard to get even reconstitution of the active like ingredient, in this case melatonin. Also be careful with iron supplements unless you've been told to take them by your medical provider. If you take iron unnecessarily for a prolonged period of time, you can get iron overload, which is no bueno. Check out my video on signs of too much iron. Neosporin even has a lip balm. Look, white petrolatum. Is that all that this is, or is it white petrolatum plus antimicrobials? No, this actually looks okay. All right, I'm not seeing the bacitracin then in this. This actually looks like it might be pretty good. As I ragged on it, $9.49. Carmex, on the other hand, is a notorious product for causing irritant cheilitis because while it's got the GOAT white petrolatum, it also has camphor, menthol, salicylic acid, and phenol, which feel really soothing going on, but then are super irritating to the delicate lip skin. And so then an irritation develops. So what do? You reach for more Carmex and the cycle repeats itself. Speak of the devil, they at least came out with an SPF 30 lip balm. Does it have this actually is looking promising because I'm not seeing the camphor, the salicylic acid, the menthol. This just has basic SPF lip balm type ingredients. Okay, this might actually be worth a try. 2-pack. I think I'm gonna snag this. Water resistant. I wish it were SPF 50, but is it just me? SPF lip balms are getting harder and harder to come by. I'm gonna snag this. Stay tuned. Well guys, lots of great finds today at the drugstore. On the end slide, I'm going to link my recent shop with me video from the drugstore, so definitely check that one out. I hope you're having a great start to 2024. If you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye!